We have people in vision science specifically who are looking at how do we use the visual system as a surrogate or as a way of a biomarker, a way of understanding when the brain is injured and what its health status is. So in traumatic brain injuries, for folks that have either undergone concussions or motor vehicle accidents, even some of our servicemen and women who've had injuries and returned with traumatic brain injury, there are an awful lot of symptoms that involve the visual system. So it's become a real important and popular topic to try and understand the light sensitivity, the blurry vision, headaches, all of these dizziness and imbalance factors tie into the visual system. So the research that's being done by some of our group really looks at how does the balance system, how does the interplay between our inner ear and our eyes, something that happens deep in the brain, how does that help us understand when somebody is suffering the effects of a brain injury and what's their status of recovery. The most common form of traumatic brain injury that occurs are from motor vehicle accidents. But we're seeing that even mild injuries like concussions are a form of traumatic brain injury. So students in sports have these kinds of injuries. And it turns out that a lot of the symptoms that people have in relation to these injuries affect the visual system. And what's nice about the visual system is that it really touches all parts of the brain. Vision researchers around the world now are beginning to understand and appreciate the importance that vision plays in helping to assess the state of the health of the brain. Some of the best research in traumatic brain injury, I would say, is taking place in the School of Optometry and Vision Science. We have a number of researchers who are looking at the interplay of eye movements, balance, the inner ear, and the visual system as a way of really getting at what are the earliest and most subtle effects of brain injuries. That's the bigger question that we would like to really understand is how is this magnificent mind, how do we understand it? How do we know when it's injured, when it's not well, and how do we know when it's working just fine again? Vision research at UAB is unique and powerful in one way because we really do a good job of covering a wide range of research. On one end, we're looking at cells, the molecular medicine and some of the smallest factors involved in health and disease. But on the other level, we also look at the population. And we're looking at individual patients or large groups and trying to determine what is the best health policy.